Hello, my name is Jessica Torres, and today I'm going to present my informative speech. Alzheimer's disease is within the 10 leading causes of death in the United States. It is very common on elderly that are 65 years of age and older. It has no cure. There's treatments to help so that it doesn't progress, but it'll get worsened over the years. I chose this topic because both of my grandmothers unfortunately have this disease. And so it is sad to see how they don't even remember you. So now I'm going to inform you on Alzheimer's disease, its symptoms, its treatment, and what the evaluation entails. First of all, I'm going to talk about the basics of Alzheimer's disease, which is a disease with memory loss, also known as dementia. Dementia is loss of reasoning, thinking, and remembering. According to the Alzheimer's disease, there's different types of dementia. The second most common is vascular dementia, which is after you've gotten a stroke. But there's other types of dementia. According to the National Institute of Aging, this disease was named after Dr. Louis Alzheimer's back in 1906. He examined a woman that died of an unknown mental illness. And when he examined her brain, he found out that her brain had shrunk and that she had plaques and tangled bundles of fiber, which is a main feature of Alzheimer's disease. Another feature is the loss of connection between neurons. Neurons tell your brain what to do. They'll direct your organs and your muscles in your body. And so I'm going to show you a picture of a brain. As you can see here, this is a healthy brain. This is with Alzheimer's. You can see how it has shrunk. Experts suggest that more than 5 million Americans have Alzheimer's disease and that it's becoming more costly. According to Alzheimer's Association back in 2016, $236 billion were spent in Alzheimer's. And they expect the cost to increase as well as the number of Americans that have Alzheimer's disease. This disease will require patients to have a caregiver or a relative that will take care of them most of the time. I can see my aunt right now. She takes care of my maternal grandmother, and I can see how stressful it is because my grandmother right now is at a point where she doesn't know who we are. She doesn't sleep at night. She talks a lot with people that she doesn't even see anymore. She even talks with people that have passed away already. So the caregiver has to have a lot of patience. And so I was reading on the Department of Health and Human Services on Healthline that caregivers need therapy as well as a lot of support when they have when they're taking care of a person that has Alzheimer's disease. It also says that there's more women that have more of Alzheimer's disease than men. It's double, and it's more severe on women than on men. 1 out of 3 seniors die of Alzheimer's disease. So now I'm going to talk about the symptoms of Alzheimer's disease. In this disease, they'll repeat themselves and they won't recognize relatives, close relatives. As Kenneth Cole stated on outsmarting Alzheimer's, this disease can even cause them to go into a depression. They have poor judgment, disorientation, behavioral changes, and sometimes they'll go through difficulties in speaking, swallowing, and walking. There's 3 stages in Alzheimer's disease. The first stage is the symptom-free condition where you won't even know that you're starting to develop this disease. The next one is mild cognitive impairment, where you'll start noticing to have trouble remembering or judging. And the last one is dementia, where that's already Alzheimer's. Well, you'll significantly know that you have Alzheimer's. And once they do the diagnosis and the test that they have to do, they'll know that your brain is shrinking. Last, I will explain the treatments that they can have and what the evaluation. As mentioned by Charles Elkins, when patients go through the evaluation, they're going to be asked some questionnaires about their history, not only about the patient but the family. They have to go through physical, neurological, and psychiatric examinations along with blood work. There's also CT scans, MRIs. Some might be required to have other tests. Other medical treatments are medications. It is very important if patients have a current problem that they treat the current problems that they have. There's also in-home nursing that they can have. Some might require equipment like canes, wheelchairs. Other non-medical interventions are exercising, massages, activities, support groups. A lot of them, they need to keep their brain active, and so all of this will help them so that the progression is slower. There's a lot of Alzheimer's disease centers across the country that can go ahead and help them out. And so, unfortunately, there's a lot of Americans that have this disease that has no remedy. And like I mentioned at the beginning, I decided to talk about this because I'm experiencing this with both of my grandmothers. And so I have informed you all on Alzheimer's disease, its symptoms, treatments, and what the evaluation involves, more or less, so that you all become more knowledgeable, and in case you ever have someone that has Alzheimer's disease, to support them, just to know what the disease is about.